Number 8. Heart failure reduced ejection fraction treatment. Heart failure with reduced ejection fraction. Heart failure with reduced ejection fraction. HF or EF. Also known as systolic heart failure, is characterized by a left ventricle ejection fraction (LVEF) of less than 40%. The treatment of heart failure with reduced ejection fraction aims to elevate symptoms, prevent hospitalization, slow disease progression, and improve survival. Following treatment strategies are based on current clinical guidelines. Pharmacotherapy like angiotensin-converting enzyme inhibitor, ACE inhibitor, or angiotensin receptor blockers (ALB). First-line therapy for all patients with heart failure with reduced ejection fraction, less contraindicated, reduced mortality and morbidity by counteracting the renin-angiotensin aldosterone system RAS system, and the blocker indicates for unstable heart failure with reduced ejection fraction patients to reduce sympathetic nervous system activation and prevent or decrease mortality and hospitalization rates. Mineralocorticoid receptor drug antagonists like MRAs recommended for patients with NYHA class 2 to 4 symptoms and LVEF under 35% reduce morbidity and mortality. Sacubitril valsartan, angiotensin receptor neprilysin inhibitor ARNI, recommended in place of ACE inhibitor or ALB for further reduction in mortality and hospitalization risk in patients with NIHA class 2 to 3 symptoms. SGLT2 inhibitors recommended for patients with heart failure with reduced ejection fraction to reduce hospitalization for heart failure and cardiovascular death, irrespective of the presence of diabetes. Diuretic use for symptom relief in patients with fluid overload to reduce congestion and edema. Anticoxin may be considered for patients with heart failure with reduced ejection fraction to improve symptoms, quality of life, and reduce hospitalization, particularly in those with atrial fibrillation. Ribavirin, indicated for patients with symptomatic heart failure with reduced ejection fraction, NIHA class 2 to 3 who are in sinus rhythm with a heart rate over 7 BPM provide optimal beta blocker therapy to reduce hospitalization risk. Device therapy, implantable cardioverter defibrillator, and CT are recommended for primary prevention of sudden cardiac death. Patients with heart failure with reduced ejection fraction LVEF under 35% despite optimal medical therapy. Cardiac resynchronization therapy (CRT) indicated for selected patients with heart failure reduced ejection fraction LVEF under 35%. Left bundle branch block LVPB with a QRS region over 130 ms and NIHA class 2 to 4 symptoms despite optimal medical therapy to improve symptoms and survival. Advanced therapy for patients with reduced ejection fraction with heart failure with reduced ejection fraction despite optimal medical and device therapy. Advanced therapies such as heart transplantation, mechanical circulatory support, left ventricle assist device, LVAD, or participation in clinical trials may be considered. Lifestyle modification and monitoring. Diet and fluid restriction, limiting sodium and fluid intake can help manage congestion. Physical activity encourages tolerability with participation in cardiac rehabilitation when appropriate. Regular monitoring for symptoms and signs of fluid overload and periodic assessment of cardiac function and medication efficacy. I point the triple drug with ACE inhibitor, ALB, or ARNI, the blocker, and MRA form the cornerstone of heart failure with reduced ejection fraction management, and have been shown to improve survival. SGLT2 inhibitor, a newer class of medication, showing significant benefit in heart failure with reduced ejection fraction management and have been shown to improve survival. Those without diabetes device therapy, ICT, or ICD and CRP are the life-saving intervention in selected patients with heart failure with reduced ejection fraction. Individualized therapy treatment should be tailored to the patient. Clinical status tolerance and response to therapy with close monitoring for adverse effects. The management of heart failure with reduced ejection fraction requires a comprehensive approach, including evidence-based pharmacotherapy, device therapy, lifestyle modification, and in advanced cases, consideration of more invasive intervention. So let's not. Heart failure with reduced ejection fraction, also known as systolic heart failure, left ventricle ejection fraction of less than 40%. Pharmacotherapy, ACE inhibitor or ALB, beta blocker, mineralocorticoid receptor antagonist MRA, NIH close to 4, LVF under 35%, and sacubitril valsartan, angiotensin receptor, neprilysin inhibitor ARNI, SGLT2 inhibitors, and derivative digoxin, ibuprofen, device therapy, implantable cardioverter defibrillator, ICT, cardiac resynchronization therapy, CRT, heart failure with reduced ejection fraction under 35%, LVVP with a current duration over 130 MS. Okay, an advanced therapy patient with high refractory heart failure with reduced ejection fraction despite optimal medical and device therapy, such as heart transplantation with clinical circulatory support, life modification and monitoring of diet, fluid restriction, physical activity, door monitoring, triple therapy, ACE, beta diuretic, MRA, SGLT2 inhibitor, device therapy, ICT, CLT, individualized therapy can be used.